Dr. Abdul Rauf is joining us on the broadcast. He's a consultant pediatric intensivist of the Baby Memorial Hospital from Kerala. Dr. Abdul Rauf, appreciate you joining us on the broadcast. I really appreciate you taking your time out for this very important discussion.
Yeah,
Of course,
good evening, Mr.
I
Ashish.
was informing our viewers here. Right. I was informing our viewers about how you treated one of these patients who suffered from this, infected with this particular amoeba that is now being called as the brain-eating amoeba. Now, just to help us understand, what is the condition of the child when you first saw the child, and what were your first findings?
Yeah, thank you. So let me clarify. Actually, in this year, there have been reports of 4 confirmed cases of amoebic meningoencephalitis, out of which 3 have been treated by our team. And unfortunately, 2 children succumbed in spite of all possible treatment, and 1 child is under treatment and is thankfully responding to the treatment. Yeah. So I will the example of the child who succumbed yesterday. He had taken bath in a pond 8 days back, and after 1 week after the swimming, he developed high grade fever, headache, vomiting, and which progressed over 2 days, and he became unconscious. So he was brought to from a initially from a primary healthcare. He has got sought treatment, and from there he was referred to us. And while he was brought to us, he was unconscious. So we had to put him on ventilator, gave him all necessary medications. We proved the diagnosis of amoebic meningoencephalitis as quickly as possible, and we gave him all possible treatment described for amoebic medication. As per the CDC, it's a combination of around 6 antibiotics and antifungals. But in spite of that, his condition continued to deteriorate, and unfortunately, he succumbed yesterday.
Now, Dr. Rao, from what I understand, you gave him a cocktail of multiple drugs. That, of course, is something that you believed would have treated him. Help us understand about, is there any sort of a vaccine for this? Is there any sort of a treatment methodology? Because from what we understand right now, the fatality rate in this particular illness is very, very high. So is there a clear-cut method of treating patients, or is it, again, just a luck by chance?
Yeah, that's a good question. So if we see the total cases in the world reported till now, there have been around 400 cases reported in world till now, from 1960s, and out of which around 20 to 25 people have survived. So the case fatality is reported to be around 9 to the tune of 95%. Now there is a recommended treatment protocol, and around 5 drugs have been recommended as per the Center of Disease Control USA, which includes amphotericin, fluconazole, rifampicin, azithromycin. They are different antibiotic regimen, but none of these works in a magic way, or none of this is a proven drug of choice. But this combination do work in some children or in some patients who are diagnosed very early. And we feel, I mentioned earlier, one of our patient, a 15-year-old boy who is under our treatment. He was a early diagnosis. We could start treatment within 24 hours, and till now it seems that he is improving and is responding to the medications.